Carol, thank you.
Thanks.
7:15. Now, getting more money in your pay slip than you're expecting sounds pretty good, doesn't it? But a BBC investigation has found that payroll errors are actually leading to thousands of NHS workers being referred to debt collectors.
Yes, over the past 5 years, this number has increased by almost 50%. NHS England says it's established a payroll improvement programme, as our reporter Charlie Haynes can explain.
Dr Tom Horne is an NHS anaesthetist living in Nottingham. Back in 2023, he found a nasty surprise in his postbox.
A debt collection letter dropped through my letterbox to say that I owed the trust £2,000.
He's one of thousands of NHS staff each year referred to debt collection agencies to recover salary overpayments.
I didn't hear anything for 6 months after I left the trust, and then I received a debt collection letter and a county court date through the post for an overpayment. I asked, why they hadn't contacted me first. That's when I was told, well, we have sent you a letter, and they gave me the address, which was an address from 4 years previously.
Until then, he had no idea he'd been overpaid and had to repay it immediately to avoid court.
So originally the debt would have been about £1,900, but probably once we've added in bailiff fees, interest fees from the credit card, additional tax that I would have paid on that, the cost to me was close to £3,000.
Dr Horne's employer, Sherwood Forest Trust, has apologised and promised to learn from his case. A referral to debt collectors can have serious consequences for your financial health, and our investigation has found that while the number of overpayments may have stayed the same, NHS bosses are increasingly reaching for debt collectors. In 2021, just over 1,800 NHS workers were sent to bailiffs, but that figure has been steadily rising, reaching almost 2,700 last year, a rise of almost 50%.
I was overpaid. I kept flagging it to the trust and I continued being overpaid. Eventually, despite me having not heard anything back from the trust, my family received a letter.
I've spoken to NHS staff across the country who have had similar experiences. Dr Usman was one threatened with a bailiff referral by his employer.
I had been trying to get in touch with them and they got hold of me in a way that if I had no family present to be able to open my post, I could be in a whole world of trouble.
Somerset NHS Trust have apologised to those affected by overpayments and say they're working to strengthen their governance. But Dr Usman says he is frustrated when he had repeatedly flagged the issue.
I think it just encapsulates the bureaucratic culture of the NHS and, that staff are sometimes just numbers on an Excel sheet.
I've told Health Minister Karen Smith about Dr Usman and Dr Horne's experiences and shared my data. In a statement, she said NHS staff shouldn't be out of pocket, threatened and pursued ruthlessly due to errors made by their employers. I've done the same with NHS England and they say that they're taking action.
We have established a payroll improvement programme after hearing about these awful cases and the distress caused, helping to substantially reduce payroll errors for the dozens of NHS trusts taking part.
Dr Horne hopes any changes will see more compassion for staff in the future.
They're not thinking about there being a human being on the end of that debt collection letter. They're just thinking, how are we going to plug this funding debt that we've got?
Charlie Haynes, BBC News.
Well, let's speak now to Nathan Holman, who's from the GMB union. Morning to you. How much of a problem is this at the moment?
This problem is getting worse and worse. The number of cases that I'm coming across now are just increasing on a daily basis.
And what kind of impact does that have on your members?
It's having a huge impact on my members. To have a member phone me in absolute tears because they've just received a letter through the post when the organisation has had no contact with them whatsoever. It's just absolutely appalling. So
how is it happening? Is it just the scale of the number of people who are employed? How is it going wrong?
So I believe the reason that this is going wrong is because of the austerity measures that have been put in place. Managers are making mistakes because they're under-resourced. And these mistakes then add up and create the problem that we've now got.
And are your members saying, Nathan, look, I don't think I should be paying this back, having to pay this back? Or they're saying, look, I'm prepared to pay it back, but I just have to be treated in a better communicated way?
It's a mixture of both. My members have not made this mistake, yet they're the ones that are having to pay for it. when you're in a situation where you're on minimum wage, so you're taking home around £2,000 a month, and they say to you that you've had an overpayment of £250 a month, they then take that overpayment off of you, which leaves you with £1,750 a month, but they then try to take the money back on a monthly basis as well, leaving you with £1,500. How can an individual afford to live when they're taking so much out of that individual's pay? There are other ways that this money can be repaid. Individuals can offer to work overtime to pay the debt off. They can offer to sell annual leave. And these options are not being given to these individuals. It's just, it's being sent to debt collection, and you've got to pay it back immediately or you're going to end up in court.
So when one of your members comes to you with this problem, what is your advice to them? What do you say?
So my advice to them is that we contact the organisation straight away and we put a stop on the debt collection. We then ask the organisation for a meeting. In that meeting, we request a full breakdown of the amount of money owed. 9 times out of 10, when we've asked for that breakdown, the actual amount that they're saying that is a debt is not a debt. The figures are far lower than they're predicting. I've even had one case where it was around £500 they were saying they owed. And when we actually went through the figures, etc., the organisation owed them £200.
So they're getting it wrong twice with
Yes.
catastrophic results for some households.
Yes. Definitely. I would advise the first thing they do is to question the amount that they are being told they're in debt.
How often are your members told that they've been accidentally underpaid and they're given money?
Never. if they will never get told that they're underpaid. If they discover that they're underpaid, they have to go through a long, drawn-out process to claim that money back.
Nathan Holman from the GMP, thank you for joining us on Breakfast.
Thank you.